All right, welcome. Today we are talking about Chapter 12, the last chapter in our textbook, which is all about preventing cancer. Um, and as we've seen in some of the recent chapters that we've been going through in the book, there are a number of environmental exposures, things like chemicals, radiation, infectious agents that can be some of the main causes of cancer. So really, if you're talking about preventing cancer, it comes down to minimizing risk of exposure to some of those particular agents. We've already talked about the fact that your biggest risk is age, and of course we can't prevent aging, but we can try to minimize these exposures as we age. And as I'm sure you're also aware, not smoking is probably the most effective thing you can do to reduce your risk of cancer. And we've known for a very long time that smoking is bad for you and that smoking causes cancer. Um, and although this has been clear for a very long time, smoking rates have declined very gradually, but thankfully very steadily, at least in the United States. Um, so across sort of all socioeconomic groups, we have seen smoking levels decline from the late 70s until current day. We do see this kind of negative correlation between the amount of education and smoking levels. So, for example, the more education you have, the less likely you are to smoke. And I think the good news is if you have smoked or do smoke, or maybe you have a friend or loved one that currently or has smoked, um, stopping smoking can still dramatically reduce your risk of cancer. So here we have the results of three different studies looking at relative lung cancer incidence relative to the number of years it's been since people stopped smoking. And so, of course, even if you've never smoked at all in your entire life, you still do have some risk of lung cancer. So we're setting that as our baseline here at 1. Um, and you can see, depending on the study, once you get out to having stopped smoking for anywhere between 10 to 20 years, um, that risk of lung cancer reduces significantly and, in fact, may even get back down to that baseline level. So it's never too late to stop smoking and reduce that lung cancer risk. Um, we've talked in previous chapters about the link between alcohol and tobacco and cancer. And so, aside from that synergy that we talked about previously, we do also know that heavy drinking, which they're defining as more than 2 drinks per day, that's probably normal drinking for college students, can increase cancer risk. So, cutting out the heavy drinking is definitely going to be beneficial for a number of reasons. Um, and I will point out there have been quite a few studies over the years that have shown, that there may be some other health benefits related to at least modest consumption of alcohol, specifically, typically red wine. May have some benefits in terms of reducing heart disease and stroke and things like that. So keep that in mind. Skin cancer, of course, we could reduce risk of skin cancer by cutting out our UV sun exposure. Just trying to stay out of the sun is the best thing that you can do. And there have been a number of studies suggesting that we could cut melanoma deaths in half if people just simply stayed out of the sun more and took proper precautions. If you do have to be out in the sun, wear your sunscreen, apply a lot of it, reapply. Most people are not putting on enough sunscreen to actually get the full SPF value indicated on the particular bottle. So, for example, you have a SPF 50 and they're only getting SPF 25 or 20 because they're not putting on enough. So apply liberally. We talked about the fact that chemicals in our diet could pose a significant cancer risk, and we also talked about the fact that it's challenging to try to sort out what may be harmful or may be beneficial in our diets because they are so complex. But for sure, we know that foods that are high in saturated fats, meats that have been fried or grilled, can dramatically increase risk of cancers, in particular colon cancer, but really quite a few different cancer types. Um, and we also know that just a high-calorie diet in general may increase cancer risk. So there have been a number of animal studies that have shown just simple caloric restriction can reduce risk of cancer. In this particular study, I believe this was a study with rats, and they were looking at breast cancer rates, and you see this negative correlation between calorie intake and cancer rates. And of course, this is pretty dramatic caloric restriction, right? Most people aren't going to cut the number of calories they're eating by 40%, but anything you can do to reduce calorie intake may be beneficial. And if you reduce your calorie intake, that's going to probably lower your body weight and your BMI. And we know for sure there's a correlation between BMI and cancer risk as well. So this was studied by the American Cancer Society, looking at cancer death rates over a 16-year period, so a pretty large study, and how that ties in with body mass index, BMI. So each line here is a different type of cancer, and they are setting the risk of those specific cancers to be the baseline of 1 for people with a normal BMI. So of course you still have some risk of developing cancer even with a normal BMI, but we can see as BMI increases, so does cancer risk pretty dramatically. So trying to maintain a healthy body weight is definitely going to be beneficial. So, what could we eat, right? What would be some of the good chemicals in our diet that might help reduce our risk of cancer? And I'll go through a list of those in a minute, but we always hear about the fact that, well, you want foods that are rich in vitamins and minerals. Maybe I should take supplements, right? There's tons of those. You go into the grocery store, you see all these various supplements that are available. But bottom line is there really isn't a lot of evidence out there suggesting that supplementing vitamins and minerals is going to be very beneficial. There was one study that showed multivitamin use could reduce cancer risk. They were looking at colon cancer risk specifically. So this was like daily multivitamin. But they really didn't see any benefit until you've been taking it for 15 years. So, you can take that or leave it. Might be some benefit there. And in fact, there have been other studies showing that high doses that you might be getting with some of these supplements of specific vitamins, in particular B9 and B12, could actually increase cancer risk. In these studies, they were looking at lung cancer risk in males that were already smokers, but taking these vitamins seemed to actually be increasing their risk of lung cancer. You may have heard about antioxidants being beneficial chemicals, and there's lots of foods, especially fruits and vegetables, that are rich in antioxidants. Antioxidants basically help prevent DNA damage, and I'm going to show you the picture here. I think will make a bit more sense. And the way they stop DNA damage is by blocking these what are called free radical cascades. So as you can see on the left here, free radicals are molecules that are unstable because they contain unpaired electrons. And so they will steal electrons from other molecules. So here A, free radical, steals an electron from B, right, to stabilize itself, but in the process then B becomes a free radical and is going to steal electrons from C and so on. So this is that cascade, producing free radical after free radical. And at some point you can have electrons being stolen from DNA, and that can cause mutation and DNA damage. So what antioxidants do, they are going to be chemicals, so things like vitamin C, for example, that can donate electrons without themselves then becoming free radicals, so they can basically block that cascade and hence prevent the DNA damage. So obviously that could potentially be a good thing in terms of reducing cancer risk. Excuse me. Although I found on the National Cancer Institute website a summary of 9 different randomized clinical trial studies that were all looking at the effect of taking antioxidant supplements. So these were not just part of your normal diet, but intentionally supplementing specific antioxidants. So things like, as I mentioned, vitamin C or beta carotene, vitamin E. Um, and I'll try to remember to post up the link to that site if you want to check it out. But basically, all 9 of these studies showed no positive effect of any of these supplements with regards to reducing cancer risk. And in fact, in a couple of instances, they actually showed increased cancer risk. So I think at the very least, it's safe to say taking these antioxidant supplements is probably not going to reduce your risk of developing cancer. But it might be good in other ways that were not tested in these studies. So obviously eating a healthy diet is going to be beneficial. Healthy diet, typically one that's rich in fruits and vegetables. And fruits and vegetables contain lots of phytochemicals, right? Chemicals produced by plants. And there have been quite a few phytochemicals that have been shown to have anti-carcinogenic properties. And I'll go through a short list of these here. So I'm not going to dig into all the details, but I just wanted you to be aware of what some of these were. So lycopene, found in tomatoes, isothiocyanates found in broccoli, Brussels sprouts, cauliflower, among others. EGCG, which is found in green tea. Isoflavones found in soy. Resveratrol, which is found in the skin of red grapes. And sulfides, which are found in garlic. So I know I kind of raced through these slides, but for each of these different phytochemicals, there have been numerous animal studies showing benefits in terms of reducing cancer risk. And if you go back and look at these slides, for a lot of these, there's actually specific biological activity, anti-cancer activity that has been demonstrated. So, whether or not antioxidant supplements are beneficial, for sure, eating a diet that's rich in some of these phytochemicals is likely to have some anti-cancer benefits. And it's just going to be good for you overall anyway, right? And probably going to help reduce the BMI and all kinds of other good things. While we're talking about things that we're ingesting intentionally in our diet, I wanted to mention prescription drugs. And of course, prescription drugs are tricky because this is usually something you're taking for a specific health issue, something that was prescribed by your doctor. And I know we've talked about the fact that, despite the pretty rigorous approval process that prescription drugs go through in terms of cancer risk, sometimes it just may not be known until years after people have been taking that particular drug. So to give you an example, estrogen replacement therapy that was used widely in the 50s and 60s to treat menopause in women was discovered to increase risk of cervical cancer. So basically cut out use of just estrogen treatment, found that supplementing estrogen with progestin could limit that cervical cancer risk. So that began to be used in its place. And of course, there are numerous benefits associated with that combo, but it may also be increasing risk of other types of cancer. So it's difficult, right? We're all trying to make educated decisions and do what our doctor recommends, and basically hope for the best. Excuse me. As we saw in the Emperor Maladies book, we do know for sure drugs that can interfere with hormone signaling may be very beneficial in terms of reducing cancer risk for some of those hormone-driven cancers, so breast and ovarian cancers in women, prostate cancer in men. So of course they can be used as treatments, but they may also be used prophylactically in some instances as well. So tamoxifen was really the first of these, right? Blocks the estrogen receptor on breast cells. And there have been a number of studies showing tamoxifen can significantly reduce breast cancer risk if taken before the development of cancer even. Here's some of that data. So you've got breast cancer risk in over basically, I guess 6-year period here over women taking tamoxifen versus a placebo. So a big reduction there. Looks great. Okay, maybe everybody should take tamoxifen. Not so fast, because we see if you are taking tamoxifen, it may increase your risk of uterine cancer. So again, trade-offs. Talk to your doctor. Try to stay educated as best you can. One drug or class of drugs, I should say, that has been shown in many different studies to provide some anti-cancer benefit are the COX inhibitors like aspirin. So the COX-1 and 2 enzymes induce the production of prostaglandins, which are signaling molecules that can then trigger inflammation. So of course aspirin is an anti-inflammatory, and we know at least long-term chronic inflammation is tightly linked to cancer, right? We saw that in our chapter over infectious agents that can cause cancer. There's one particular prostaglandin called PGE2 that's actually produced by colon cancer cells, and as well as some other epithelial cancer cell types. And this can inhibit angiogenesis, just to give you one example. So there's as I said, there are a lot of studies showing a benefit in terms of just low dose aspirin, daily aspirin, like baby aspirin, in reducing cancer rates. In particular, seems to be very effective at reducing colon cancer rates for reasons that are not entirely clear. But I don't know, I've read enough of these articles over the last few years that I actually started taking low-dose baby aspirin myself every day. There are, of course, other COX inhibitors, famously things like Vioxx and Celebrex, but these two were found a number of years ago to increase your risk of heart attack, so they're kind of off the table at this point. But other anti-inflammatories, things like Tylenol and ibuprofen, may have some protective effect as well. All right, so as we saw in some of the previous chapters, there's all these carcinogens that we could be exposed to in our environment that would increase cancer risk that we want to try to avoid exposure to. And thankfully, there are government agencies in place to try to regulate and limit those exposures. So you've got things like OSHA that's in charge of health and safety in the workplace, the FDA, right, which approves food and drugs. Interestingly, meat does not fall under the purview of the FDA. Instead, that's the USDA. We've got the EPA trying to keep the environment clean and keep carcinogens out of our environment. So, there have been laws that have been passed over the years trying to specifically reduce our exposure to carcinogens. One of these that's kind of interesting was what's called the Delaney Amendment, passed in 1958, has since expired, but this set a zero-risk policy for carcinogens in food. So basically any chemical that caused cancer in animal studies at any dose would be banned under this amendment. So I think this was well-intentioned, but hopefully you've gotten the idea as we've gone through this course that exposure to low doses of carcinogens may be just fine, right? So although this is well-meaning, it's probably not really very practical, which I think is why it was left to expire. One metric that some of these agencies would use to try to help establish their guidelines is what's called a HERT value, which stands for human exposure and rodent potency. And this is calculated by taking the typical lifetime human dose of a particular carcinogen and dividing that by the dose of that carcinogen that causes cancer in 50% of animals in an animal study. And I'll show you some typical HERT values here on the next slide. But this can be a really useful metric, but one disadvantage is because it's taking into account that animal data, right? There may be certain carcinogens that either do or don't cause cancer in rodents at the same rate that they might cause cancer in humans. So if you happen to be dealing with one of those, obviously your HERT value could be skewed one direction or another. But this is what some HERT values might look like. The first two would be things that agencies would definitely want to limit exposure to. So these would be, potent carcinogens that you might come into contact with through occupational exposure. You get these high HERT values. And then you've got other carcinogens that might just be present in normal foods. Things like an apple has caffeic acid in it, which is a carcinogen at high enough doses in animal studies. But of course, we're not avoiding apples, right? They're a healthy food source. So you get these very, very small HERT values, but it would be up to these individual agencies to try to establish some cutoff in terms of what may or may not be acceptable. Okay, so just to wrap this up, I know there's been some conflicting evidence in this chapter, but I put together this little list of 6 things that we might all be able to do to reduce our cancer risk. So, of course, and this one is not controversial, stop smoking, right? Second would be eat lots of fruits and vegetables, maybe throw some garlic in there. For sure that's going to be good for you for a number of reasons, but you're going to enrich your diet with those phytochemicals that may reduce your risk of cancer. Cut out the heavy drinking, but maybe drink a little bit of red wine. I don't know, as I said, there have been a number of studies showing there may be some health benefits associated with limited amount of red wine consumption. Maybe consider taking a low-dose COX inhibitor, baby aspirin, or maybe some other anti-inflammatory. Maybe take a multivitamin, although, as I said, the only real study showing benefit there said you had to take it for 15 years. So if you're going to take it, don't miss a day for the next 15 years. And then lastly, try to maintain a healthy body weight, right? So again, that'll be good for you for a number of reasons, but has definitely been shown to reduce cancer risk. So, all right, that's it. Thanks for listening.